Greetings. My name is Mike Levis, and I'm an avalanche instructor with the Mountain Hood Ski Patrol. Effective avalanche rescue includes more than finding and extracting a victim. A critical part of an effective rescue is the post-extraction first aid provided. In this module, we will discuss some considerations for first aid in an organized rescue scenario. This is not a rehash of OEC topics. We assume all rescuers are proficient in basic patient assessment and trauma first aid. This is more of a discussion of the unique considerations in an avalanche mass casualty scenario. Avalanche mass casualty incidents are not common events, but when they happen, they can result in many injuries and a large number of patients to be cared for. This slide indicates some of the major avalanche MCI events over the last several decades. It's interesting to note that although the number of instances are rare, these events account for about 10% of overall avalanche fatalities in that time period. It's also interesting to note, if you look at the ski lift accident line there, that the ski lift accident casualties, the number of dead and injured, is about the same as the avalanche casualties. So that's just a little bit of food for thought. We practice all the time for ski lift accidents. Avalanche accidents cause just as many injuries as ski lift incidents do. Let's review the causes of death in avalanche accidents. As we mentioned already, about 25% of deaths occur due to trauma before burial. These tend to be head, neck, and spine injuries and internal bleeding. Based on this, it's important that rescuers show up prepared to deal with these kinds of injuries. The secondary response team should have backboards, C-collars, and a full trauma kit. The leading cause of death is asphyxia. An avalanche victim is basically a drowning victim. The airway is obstructed by snow or ice, hypoxia. There's a buildup of CO2, hypercapnia, both of which eventually lead to cardiac arrest. Note, in all cases, hypothermia is a consideration. The patient has been buried under snow, so once extracted, they'll need to be rewarmed to stabilize body core temperature. So let's discuss some more detailed first aid considerations. The International Committee on Alpine Rescue has developed an algorithm for avalanche patient assessment, which I'll show in the next couple of slides. The key factor here is burial time. Once the patient is excavated, the responder has to assess if there is lethal trauma. If lethal trauma is present, rescue efforts stop. If lethal trauma is not present, the rescuer checks for a patent airway and checks for a pulse. If the patient has a patent airway but no pulse, CPR is initiated if burial time is less than 60 minutes. Treat the patient for hypothermia. If the burial time is greater than 60 minutes and the airway is not patent, no CPR is needed. If the patient has a pulse and patent airway, treat other injuries. Given the MOI, spinal motion restriction protocol should be followed. This is the flow chart developed by the ICAR committee. We will discuss this in the following flow chart on the next slide in more detail in our breakout sessions. If you see that this flow chart starts with assessing for a patent airway, duration of burial. If it's less than 60 minutes, then there's one branch that you follow on the left. If it's greater than 60 minutes, then you follow the branch on the right. Both of these eventually get down to an ALS module below, the pink block, where it says use algorithm figure 3 for decision making. That's on the next slide. So this is the algorithm for decision injuries. And as you can see, lethal injuries, yes, discontinue, don't start CPR. No, duration of burial greater than 60 minutes, less than 60 minutes, and so on and so forth down the branches of the flow chart here. So again, we're going to go over all this in the breakout session and cover it in more detail and discuss it. So don't get too hung up on it in this video. Once the patient is stabilized, transportation will be a critical decision. The medical triage manager and transportation manager will need to consider many of these issues. How many patients are they urgent? Are they all urgent, requiring expedited transport, such as a helicopter, or can some be transported by slower means like snowmobile? Will the transport be directly to a hospital, or will it be to an intermediate staging area? And what treatment will be needed during transport? Where will patients be transported? Who will notify the hospital and confirm receipt by the hospital? As you can see, there are many considerations. The time to think through these different scenarios is before an incident occurs as part of resort avalanche response planning. This brings us to the end of this module. Thank you for your time.